there, I'm Dr. Danny Leonard from Eclipse Wellness in Sterling, Virginia. And I just wanted to talk about a topic that I see a lot and there's a lot of confusion around, and that's trigger point dry needling, specifically for low back pain. So I just wanted to quickly go through some of the basics and then talk about how I actually use dry needling in my practice in Sterling, Virginia as a physical therapist. Now, dry needling is much more common than it was 8 years ago when I started doing it. A lot more people have more familiarity with it. But because of that, people kind of come in with preconceived notions and they don't totally understand what it is. They're not coming in fresh, they're coming in saying, oh, I saw this thing online, I talked to my friend about it. So I wanted to clear up some basic facts and how I use it as a physical therapist in my practice. So the first thing to understand is, what is the trigger point in trigger point dry needling? So imagine we're talking about your bicep here. So all muscles are what we call cross bridges. So they extend and they contract. So if I'm extending my bicep, all these cross bridges are coming across like this. If I'm contracting it like that, they're all coming together like that. A trigger point happens when a small area, millimeters wide, becomes stuck. So when it goes to contract, that area is not moving. When it comes together, it's also not moving. So what you get is a little buildup of inflammation in that area because that little cross bridge isn't moving like it should. So that can cause pain, that can cause inflammation in that area, and it's a very painful thing. That can lead to, if you've ever felt like a knot in your upper trap or your calf or anything like that, sometimes you can feel a trigger point, but they can be very small. So the first step in understanding trigger point dry needling is to understand a trigger point. Now I want to talk about what dry needling actually is. So now that we understand what a trigger point is, it's important to understand what dry needling is. So if we're trying to stimulate a trigger point to get it to release, go away, feel better, we can use massage, which is effective. But as I mentioned, sometimes trigger points are very small, sometimes they're very deep under layers of muscle, so it'd be hard to get there with just your fingers or pressure, and sometimes that can cause more irritation of the area of trying to really lean in there to get it to feel better. So dry needles are very thin, wispy. I don't know if you can see it on the camera, but it's called a dry needle because when you get a vaccine or a shot or anything like that, it's called a wet needle, which is where it's big enough that liquid can get through, the vaccine or anything like that. A dry needle is so thin, nothing goes through. So what we do with this needle is we try to insert it, hit the trigger point, cause it to twitch and release. So the best analogy for a twitch would be it's a reflexive twitch. So imagine going to the doctor and you tap your knee and you kick out. It's the same thing happening where you should feel the muscle twitching. That's causing a reset where that muscle that's not expanding and contracting is stuck like this. It twitches and then causes that release to hopefully start moving better. Now that can release some inflammatory chemicals, making it a little bit sore in the area, but it does give you the best shot at long-term relief in that area. So next, I want to talk about kind of going back a little bit to what low back pain actually is, and then talking about how I actually use dry needling in my practice in order to treat back pain. So we've talked about understanding what a trigger point is, what dry needling is. Now let's talk about low back pain and how I actually use trigger point dry needling to decrease low back pain. So it's important to understand that back pain is very complicated. There can be many causes, whether it can be strained muscle, strained ligament, herniated disc. There's all kinds of things that can be going on. And the hard thing is that we often don't know the exact cause. Even if you get an MRI, there's research showing that MRIs, especially the older you get, you'll tend to have a herniated disc. You'll have what we call them kind of internal wrinkles. If your body is wearing down in different ways, and that's totally normal. That's natural. That may be causing your pain. That may just be something that's been there for 10 years that you never knew about because you never had an MRI on your back before. So with trigger point dry needling, we're obviously addressing the muscles. So using a herniated disc as an example, typically someone with a herniated disc has pain with bending forward. So their muscles are probably going to shorten around that disc and the bigger muscles in your low back because they don't want to bend forward. They haven't done it in a while because typically even within a couple weeks of pain, you're stopping yourself from bending forward. Things are getting tight. So when you do try to bend forward, the disc might be irritated or that may have healed or that may not have been the problem to begin with, but the muscles are now tight and they're not letting you move. So with trigger point dry needling, we address acute as well as chronic pain. Acute pain being, oh, I just strained a muscle in my side. I've just got that trigger point that it laid down to protect itself. We dry needle it, clear it up, we're good to go. Chronic pain can be, oh, there's tightness in different spots. We're moving funky because of a herniated disc we had in the past, or we think we had one, we just can't bend forward. And so we use the dry needling to loosen up the muscles around it, to put yourself in a better position to heal and for that activity to take place. So typically how I structure physical therapy sessions, we're going to start with the manual. We'll do a reevaluation first of kind of watching how you move. We'll do the manual therapy first. So we'll palpate the area, kind of find, okay, these are the tight areas. This is where we think the trigger points are. Let's dry needle those trigger points. Then we'll follow that up with different types of manual therapy, massage, cupping, scraping, things like that. Because you typically don't want to just dry needle and then leave it because it's going to be a little bit sore. It releases inflammation in the area. So we want to do some nice manual therapy, stuff like that, just to kind of loosen it up. Then what we're going to be doing is starting some mobility, typically on the physical therapy table. So if we have low back pain, a child's pose type position where we're on our hands and knees, we're flexing, or we're laying on our back, we're hugging our knees to our chest, trying to stretch in that way that's provocative, that irritates you, but doing it in a way that's not threatening. Part of that is we're not working against gravity, so we don't have as much stress on us. But another thing that we want to consider is your brain's perception of pain, where if you've had weeks or months where your body's been telling you it hurts to bend forward, your brain eventually says, I don't want to bend forward anymore. So it's just not going to do it. So sometimes we have to trick the brain a little bit, because if we stand up and just try to bend, after dry needling, it's going to say, whoa, 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 this is too much. We have to gradually introduce it and figure out how we're going to do that. So next, I want to show you where we go from mobility on the table and how we take that to exercise to make it more functional day to day and prevent the pain from happening again. So I was just telling you about how I typically do mobility exercises and things like that on the table after dry needling, specifically for the low back to stretch it out. Now, I think it's important to understand that everyone's progression is different with exercises and physical therapy. So if your back is super flared up and all you can tolerate is dry needling, manual therapy, and then some light stretching, and as soon as you stand up, your back starts to bother you, then that's fine. That's all we're going to do. I think it's important to dose exercises to whatever the client's body is ready for. So if you are feeling good when you stand up, then we want to push that a little bit to try to get gains and improvement as quickly as possible. A lot of physical therapists and healthcare professionals err on the side of caution. They end up doing their clients a disservice because they're not actually helping them. They're kind of keeping them in a bubble where they're scared to do anything. So if you are on the table and you feel good and you stretch and everything and we're good to go and we stand up and we have the low back pain of bending forward, then we'll just start with some simple, going into toe touch, just trying to relax that low back. So now we're working against gravity. So this is an extra stress that wasn't maybe on the table. And it's typically a fearful position where if people are afraid of bending forward, as soon as you stand them up, it's going to be a lot harder to do so. So we're just gently going through that motion of trying to relax, coming down, maybe taking some deep breaths, coming up and down. If that works and that's okay, or we have a little bit of pain, like minimal pain, then we might try starting to load it with some dumbbells. Now, we might utilize, a deadlift, keeping our back nice and straight, just working on strengthening the low back. We may be more interested in mobility and decreasing guarding in the low back, so we may do more of a Jefferson curl, where we just try to relax the low back and round down as low as we can. It just kind of depends on what the client needs. But it's important to tie in doing something with weights, because a lot of people I see, obviously, I went to lift a 50-pound box and that's when I hurt my back. If we never get back to lifting that weight again, one, there's always going to be that fear in your mind. You're always going to be the person who says, well, I just don't lift heavy things. And then the rest of your life is a little bit tricky. You're always going to be guarded. Or you become that person who says, I have to lift them in different ways and I have to get crazy with how I'm doing it. And you're creating compensatory movements that can stress other areas. My goal with physical therapy is to get you back to where you were, if not better. So if the 50-pound box was a struggle for you to lift, we want to lift 60, 70 pounds easily here at Eclipse Wellness. And that way we know we don't have to worry about the 50-pound box because we've got that covered. So your physical therapy should take you past the point that you were before, so you're less likely to re-injure yourself. So next, I just want to wrap up real quick kind of what we talked about, put all my points together. So just to quickly summarize everything we talked about today, the most important thing with dry needling is understanding why we do it. Because I have, like I said, so many clients come in here, people have heard of dry needling, their friends gotten it, their parents gotten it, their spouse has gotten it, and all they hear about is the needle, and they think that we're going to radically change our treatment strategy of, we're just going to do the dry needling and that's it, or it's going to change things. Dry needling is a tool just like anything else. I've been dry needling for over 8 years as a physical therapist. I remember when I first started dry needling, it was kind of like, this is everything, this is going to fix everything. It doesn't fix everything. In my opinion, it is one of, if not the most powerful modality in terms of manual therapy, of relieving muscular pain and everything like that, but it's not everything. If you just get dry needled and then walk off the table and go home, you're not going to get better. It might feel better for a short time and loosen up, but that restriction is going to come back because your body is moving in different ways. So your physical therapist, as we do at Eclipse Wellness, should be integrating dry needling in your entire treatment plan. There should still be manual therapy afterwards to decrease the inflammation, to relax the muscles. Okay, now we're doing some mobility. If you can handle it, we're doing some strength. The biggest thing is, obviously there's fear with needles. I can't discount that. But understanding the reason for dry needling, how it integrates in with everything to give you a better outcome in terms of your pain. If it didn't work, we would not be using it as physical therapists, but it does work. Now, I have some clients who just don't really want to use it, and that's totally fine. But those who do, I do see good benefit in it. If you have any other questions, reach out. I also posted a blog about this that has some more information. I've posted other blogs about dry needling. If you have any other questions, my email is below. Reach out. I'd love to answer them just to kind of demystify this technique and everything. Because like I said, it really is helpful. I wouldn't do it if it wasn't helpful. So I appreciate you watching and learning, and hopefully you learned something from this, and share this with someone who has any questions about dry needling. Thanks.